We've all been there, haven't we? Lying in bed, watching the hours tick by, tossing and turning. Our mind races, our body feels restless, and sleep seems to be playing a frustrating game of hide and seek. You wake up feeling like you haven't slept at all, groggy and unrefreshed, even after a full night in bed. This common yet often dismissed experience is what we call restless sleep. It's more than just an occasional bad night. Restless sleep is a pervasive concern, affecting countless individuals across all age groups. While it might feel like a personal struggle, it's increasingly recognized as a significant public health issue, impacting our daily functioning, our mood, and our long-term health. Think of it as sleep that's disrupted, unrefreshing, and characterized by frequent awakenings or periods of being half awake. For adults, it's often a descriptive term, but for children, researchers are actually proposing a formal diagnosis called restless sleep disorder, or RSD, underscoring just how serious these disruptions can be. Our modern world, with its relentless pace and constant connectivity, only seems to be amplifying this challenge. We're plugged in 24/7, our electronic devices glowing late into the night. This digital overload, combined with heightened stress, is fueling something experts are calling sleep anxiety, especially among younger generations. We're even seeing trends like sleep divorce, where couples choose to sleep separately to prioritize their individual sleep quality, reflecting a significant shift in how we value restorative rest. It's clear that understanding why our sleep becomes so fractured is the first step towards reclaiming our restful nights. So why does sleep become so restless? It's rarely one single cause. Rather, it's often a complex interplay of factors, much like a mosaic where each piece contributes to the overall picture. Let's start with our daily habits, what we call lifestyle and sleep hygiene. This is often the most straightforward place to begin. Think about your routine. Inconsistent sleep schedules, that late night heavy or spicy meal, too much caffeine, alcohol, or nicotine before bed, and of course the ever-present blue light from our phones and tablets, signaling to our brains that it's daytime, not time for sleep. Even vigorous exercise too close to bedtime or certain pre-workout supplements can be culprits, revving up our systems when they should be winding down. Then there are the environmental factors within our control. Is your bedroom a sanctuary for sleep? An uncomfortable mattress or pillows, a room that's too hot, too cold? Yes, even cold weather can disrupt sleep. Excessive noise or too much light can all play a significant role. Your sleep environment should be a calm, dark, and cool haven. Perhaps one of the biggest contributors is our mental and emotional state. Stress, anxiety, depression, grief, even just a mind full of racing thoughts about tomorrow's to-do list can make genuine rest feel impossible. This internal chatter keeps our bodies in a state of alert, preventing us from sinking into deeper sleep stages. Next, we look at medical conditions and sleep disorders. Chronic pain, frequent nighttime trips to the bathroom, hormonal shifts, or specific sleep disorders like insomnia, sleep apnea, where breathing repeatedly stops and starts, or restless leg syndrome, that irresistible urge to move your legs, can all fragment sleep. Certain medications, neurological conditions, and even genetic predispositions can be at play. Our internal body clock, our circadian rhythm, can also get thrown off. If you're a shift worker or have recently experienced jet lag, your body's natural sleep-wake cycle can be out of sync with the external world, leading to very restless nights. And finally, age-related factors contribute. Sleep patterns naturally change as we get older. Children might face unique challenges like bedwetting that interrupt sleep, while conditions like sleep apnea and RLS tend to increase in prevalence with age.
The fallout from restless sleep is far-reaching. It's not just about feeling tired the next day. It leads to daytime sleepiness, reduced cognitive function, making it hard to concentrate, remember things, or make decisions. You might find yourself more irritable, your mood more volatile. Beyond that, it can worsen or increase the risk of mental health conditions like depression, and even elevate your risk for serious medical conditions such as heart disease, stroke, and diabetes. This isn't just about comfort, it's about our overall health. The good news is that there are many effective strategies to address restless sleep. It often requires a multi-pronged approach, like piecing together a puzzle. First and foremost is improving your sleep hygiene. This means establishing a consistent sleep schedule, Yes, even on weekends, creating that cool, dark, and quiet sanctuary in your bedroom, and crucially, putting away electronic devices at least 30 to 60 minutes before bed. Be mindful of your evening intake of caffeine, alcohol, and heavy meals. Regular, moderate daytime exercise is also incredibly beneficial, just not too close to bedtime. For chronic insomnia and persistent restless sleep, cognitive behavioral therapy for insomnia, or CBT-I, is considered the gold standard non-pharmacological treatment. It's not just about sleep pills. It's about retraining your brain and body through techniques like stimulus control, associating your bed only with sleep, and cognitive restructuring, challenging those unhelpful thoughts about sleep. Experts like Dr. Andrew Crystal advocate for CBT-I as a first-line treatment, and there are even FDA-approved digital programs emerging to make it more accessible. It's also vital to address any underlying medical conditions. If you suspect sleep apnea, RLS, chronic pain, or mental health issues like anxiety or depression are contributing, please speak with your doctor. Proper diagnosis and treatment are crucial. For some, medical interventions may be discussed with a doctor. This could include short-term over-the-counter aids, certain supplements like melatonin, or prescription medications for specific conditions. However, it's important to approach these with care, as the scientific evidence for many natural remedies is limited, and they can sometimes mask underlying issues. To help understand what's happening, healthcare providers might use diagnostic tools such as sleep logs, wearable devices for sleep-wake actigraphy, or even a full sleep study called a polysomnogram, which can provide a detailed look at your sleep architecture. While there's a great deal of research and understanding, there are still ongoing discussions. For instance, the debate continues about whether a formal adult diagnosis for restless sleep should emerge, similar to the proposed restless sleep disorder in children. Researchers are also working to differentiate between restless sleep that's a primary issue versus that which is a symptom of another condition, as this significantly impacts treatment. The effectiveness and safety of many over-the-counter sleep supplements are still widely debated, emphasizing the need for evidence-based approaches. And while CBT-I is excellent, access to trained therapists and insurance reimbursement for digital programs remain barriers for many. Ultimately, restless sleep is a complex phenomenon influenced by our biology, our environment, and our choices. But the good news is that we have an ever-growing toolbox of strategies and insights to help. By understanding the multifaceted nature of restless sleep and taking a comprehensive approach, we can begin to reclaim the deep, restorative sleep our bodies and minds truly need. Remember, your journey to better sleep is a marathon, not a sprint. Be patient with yourself, seek professional guidance when needed, and prioritize your rest as a cornerstone of your overall well-being. Sweet dreams await.